Hi, my name's Lynette Campbell, and we're going to be demonstrating how to take a blood pressure and finding actually your baseline where to start. Okay, this is going to be skill 21-6 in your book. And the first thing that it tells you to do, of course, is after identifying your patient and all that stuff, this is straight up for the blood pressure, you're going to assess whether there is a contraindication for taking a blood pressure in either of the patient's arm. If the patient has had a mastectomy or they have a dialysis shunt or an IV or anything like that, you would not want to take the blood pressure in the arm. And you would be able to actually take using the popliteal artery on the back of the leg. Okay, but for all practice purposes, this is typically where they're done, but you would always make sure that it was okay to take a blood pressure in that particular arm. Okay, I already have the cuff on. The cuff has to fit. It has to be, I think it's within 2/3 of the, let me make sure on that, on the width of the cuff, and it has to be not too big, not too small, because it can actually change the numbers, make you have an incorrect reading, okay? So, and like I said, if it's too small, the Velcro is not going to stick and it's not going to be accurate anyway. If you have a person that's very large and that you do not have the proper cuff size, then you, for the arm, you can always move to other parts of the body. But this is primarily where we go. You may be down here. It could be on the ankle. It's taken a lot of places, but this is typical. All right. You're going to get the patient in a comfortable position. You want them sitting. If they're sitting, you want their feet on the floor for about 5 minutes. If they're laying down, you want them laying down and being calm for about 5 minutes, because moving around changes the dynamics. You also want their arm as close, the blood pressure cuff as close to heart level as possible. So you may want to prop the patient's arm up on a pillow, and so that it's close to heart level as possible. Or if they're sitting in a chair with their feet flat on the floor, you would want maybe put their arm on the bedside table or a countertop or something. All right. Again, you're going to need some quiet. Okay, you're going to be listening, and so you will need a quiet environment by turning off TV, maybe asking family to hold it down for a few minutes, or shutting the door. You will need to apply it smoothly over the patient's arm, which I did with the center of the bladder over the brachial artery. This is the brachial artery. This would be right here. And most blood pressure cuffs have markings for a left or right. That's on the inside of the cuff, but it shows you where to put it, okay? Because your stethoscope is going to go here. All right, but before we get to all that, this says you're supposed to place the cuff 1 to 2 inches above the antecubital space. The antecubital space is literally the bend in your arm. So the cuff is 1 to 2 inches above the antecubital space, because this would be it right here if he had one. All right, you want it wrapped tightly, but you do not want it too tight, because you're going to pump it up tighter. So you need at least to be able to put 2 fingers under the cuff, not loosely, but be able to get 2 fingers under the cuff, and that way it's not too tight. Position the gauge so you can easily visualize. This is what you're going to be watching, so you need to be able to see it. Some people just lay it on the patient. Some can put it on the cuff. It doesn't matter as long as you can see it, wherever you want to put it. All right, you're going to take the valve on your cuff, and you're going to turn it all the way to the right, clockwise, okay, so that it's tight. And then that's how it would be before you start pumping it up, because you're going to be loosening it like this while you're listening. Okay, you'll be turning it counterclockwise while you're listening, very slowly, waiting for the blood pressure to check your blood pressure. But to lock the bulb and lock the cuff, you're going to turn all the way to the right, but don't make it too hard to turn with one hand. Okay? Then, first thing we got to do is we got to decide how far we want to pump up the cuff. Okay? Now, you may watch people that will go straight in there and just pump it up to 180 or 200 right off the bat, and obviously that's not correct for everybody. Okay? There is a range. So what we do first, the first thing we're going to do is this thing is now, it's occlusive. In other words, it is going to occlude that artery. When I pump this up, the pressure is going to be so tight that it occludes the artery. So anything I'm feeling below here, I shouldn't be able to feel anymore if I pump this up. So what you're going to do, and you can use the brachial artery as well, but that's a little harder to feel. This one, you can use the radial pulse, and your book says that in step 10, okay, in this chapter, chapter 21, step 10 tells you can use the radial artery also can be palpated, okay? So what you're going to do is you're going to hold your hand. You're going to find that radial pulse again, okay? You're going to find that radial pulse again. I'm going to do it with this hand so I can demonstrate better so you can see this. And I'm going to pump this up, and I'm going to pump and pump and pump until I can't feel the pulse anymore. Now I don't feel it. Right there. I'm gonna say about right here. Let me take it down a little bit. Okay, I'm gonna say that I quit feeling it about 144. Okay, I can't feel the radial pulse anymore right here with this pumped up to 140. Okay, so I'm gonna let it out. You can see my needle drop back down. And what the book tells you to do, what you do is that you take that 140, when I quit being able to feel the radial pulse, because it was occluded, it was cut off by the cuff, I will add 30 to that. And this allows for the gap in case when you first start listening that you miss something. Okay, it's an oscillatory gap, okay? Because you're going to be listening, and that 30 extra little points gives you a chance to see what you've possibly missed. So if I lost it couldn't feel this anymore about 140, I'm going to pump him up to 170 to start taking his blood pressure. So he's rested a minute since I've done that. I'm going to put my stethoscope on. Forgive me if I talk louder with my stethoscope on. I'm going to put my stethoscope in what would be his antecubital space. And again, I'm going to hold it right here. We're going to pretend like it's right there. I'm going to hold it down. It should be flush with the skin. It don't need to be on a crack and have any gap under it. It needs to be flush with the skin. So we're going to say that it's flush with the skin there. And then I'm going to pump this back up to 170 because I'm adding my 30 points. And I'm going to slowly let it out. So I'm going to pump up to 170. All right. Now I'm going to start slowly letting it out. And what I'm listening for is the first heartbeat sound I hear. And I'm going to say that I hear heartbeat now. So that would be his systolic blood pressure. And I'm listening for it to go away. Well, I can't hear any more heartbeats. Okay, I can't hear any more after 60. So that would make his blood pressure, systolic would be 120. That's where I first heard it. And the diastolic would be 60. That would be the last heartbeat that I heard. Okay? And there's lots of other sounds. If you're moving around any, you're going to hear little sounds. So it's very important that you hold that very still. And like I said, so you're listening, the first heartbeat that you hear is your systolic. That will be your systolic, your top number of your blood pressure. And you'll keep listening. It'll sound like a swooshing sound a little bit. And it'll keep beating. And it's steadily going. And you're steadily dropping, turning your little needle, your little dial, and you're turning it down. And then the last heartbeat that you hear is your diastolic. Okay? So essentially what you've done, when you blow up or pump up the blood pressure cuff, you're occluding the artery. In other words, you're choking it off. All right? And when you start loosening the pressure, then the blood obviously is going to come back through. So that's telling you what your blood pressure is. That's how much pressure is exerted through your vessels to get to in and out of your heart and through your lungs and so forth. That's what blood pressure is. It's the amount of pressure exerted, okay, to pump blood through your heart, to and from your heart. So that goes along exactly with the book. Okay, you can read it. I just wanted to demonstrate it. But never just walk into a brand new patient and just pump that up to whatever number crosses your mind and start taking blood pressure. You need to check the radial pulse first. When you quit feeling the pulse, then you know that's where you need to start, and you will add 30. And then when you start listening to take the actual blood pressure, you will start at those two numbers combined. The one you counted here, and add 30 to it. So read that very carefully in your instructions, and that's how you will be checked off. If you skip the radial pulse part first, then you're not going to pass the checkoff. That is how you establish where to start. That is very important. So, thank you.